are thus. First of all, we tend to give the flu vaccine during the time of the year, but things are out there, So and people's minds kind of like try to be logical, but they're really not, So, for example, I got this shot, and then a couple of days later, I got sick. Therefore, it must have been the shot. Well, that's kind of basic Aristotelian logic. I think it's Aristotle. But it's wrong. I mean, just because something happened after the other does not mean that they're related. So it's a little hard to deal with that. Oh, look at that. We are in business.
We are streaming live.
All right. The vaccine provokes an immune response. So it is possible that for a day or so you might feel a little punky. It happened to me a couple of years ago where I got to get the flu shot. And really, it was just very fleeting. Just for one day, just a little, under the weather, But the reason, that's usually the reason, though. People get other illnesses, and they just swear it was the shot, I always say, well, I stubbed my toe last week, and then I got sick. So it must have been that toe injury that caused me to get that bronchitis. I don't know.
Right. And it can happen, right? I mean, you can feel a little sick, but that shouldn't deter you from getting the shot, getting the protection that you need and that the community needs.
Right. And I just think it's true more than ever. So it's out there. Call the police, right, Robin?
What are we going to do? Call the police. It's out there.
All right. So if you have not had the flu shot, please consider having it done. Particularly if you're higher risk, but by the way, everybody, in the community.
So how did you help those people who tested positive for the flu?
We have a medication that's used commonly called Tamiflu. There are some other medications that were becoming available last year. I don't quite, not quite in the habit, or I've yet to prescribe them. There's an old adage in medicine. Oh gosh, which is never be the first to prescribe something and never be the last to prescribe something. So sometimes, and I'm just emphasizing this sometimes, if I think Tamiflu is good enough, I'm kind of waiting for the dust to settle on a new product before I decide that this one is better. And remember also, new products tend to be expensive, which means insurance companies tend to not want to cover it. And I do think it came up last year with one of the newer product. I have to look up the name of it. Patient asked for it, so I prescribed it, and then it was a prior authorization. And by the time the prior authorization got sorted out, any potential benefit from the medication had passed. By the way, the patient got better without it. So, anyway, so if the patient meets certain criteria, they are a candidate for Tamiflu. I think if they are presenting within 48 hours of symptom onset, I think if they're in a higher risk category, I think also the argument about, maybe it prevents transmission. Remember, Tamiflu can also be used for prophylaxis. People exposed, used a lot in nursing homes when there are some flu cases. The other residents may be placed on the medication to control the outbreak. I think it's a pretty well-tolerated medication. In kids, you can get some kind of weird behavioral side effects. It's interesting like that. But anyway, that's really it. That was just a quick aside to tell people to remember to get the flu shot if they've not done so yet. But I thought just a little aside, a little small topic, but it happens. Everyone knows a person like this if it's not yourself. And it reminds me of I thought about this topic because I was watching that Saturday Night Live skit, the Christmas skit, where they have Pete Sweaty and... I'm not going to say more about it because it's a little off color. Do you know what I'm talking about?
The Sweaty Bakery?
Yes.
Okay. I've seen the clip.
All right. So anyway, it is known as hyperhidrosis. What do you think
Hyperhidrosis.
That means? Yes.
Oh, no. What is that?
It means you're sweating too much. And it's a common problem. Men, women, old, young definitely, middle-aged. It actually tends to not be such an issue as people get older. But it can be a big problem. It can make someone uncomfortable, someone embarrassed. It can interfere with someone's social function, someone's work function. Some people have different types of sweatiness. It could be axillary in your armpits or palm.
On your right on your hands.
Yes. So anyways, this is a pretty common problem. So why would you sweat so much?
So hyper means you're sweating more.
Yeah, hydrosis is sweating, and hyper means more, as opposed to the opposite, hypo.
And this is just sweating for no reason, like you're not working out or.
Right. This is that would be what I guess we would call that physiologic sweating. And that probably not a problem. Someone's working out, you kind of want to build a good sweat. It's when someone is, at work or someone. I when I was younger, I had this problem. I remember, being embarrassed to raise my hand in class. Because you could. I remember we had an English professor who had that problem, and he would be talking with his hands, and
All wet.
Well, he wasn't embarrassed, but you couldn't help but notice in the audience.
Right.
He seemed to not care at all. All right, so some common causes of sweatiness. First one is, and this is alphabetical, alcohol use. Some people have a couple drinks, causes some flushing. And also people who drink too much, if they can kind of some withdrawal symptoms, during the daytime. People with pulmonary problems, and that kind of makes sense too, because you're working a little bit too hard to breathe. Again, likewise, heart failure. Hormonal problems. Classically, the thyroid. If the thyroid's up too high, you'll have some excessive sweating. But also other problems like just diabetes. Remember, diabetes causes fluctuations in glucose levels. So when someone has low glucose, that's one of the classic symptoms of hypoglycemia is hyperhidrosis. Kind of a sweatiness, an anxiety. Your body is saying, heart's pounding. You're feeling like lightheaded, dizzy. Your body's saying, feed me and feed me quick. The next one is just a fever, kind of common sense. What's called gustatory, such as spicy foods. The famous Seinfeld episode with George Costanza eating the Kung Pao, and how it makes him sweat, and his employer thinks he's nervous about something. And then we get into potentially more serious things, malignancies, certain types of cancer secrete hormones that cause it. And we're going to get back to medications, because I think medications probably should be number one. We're close to number one.
So the body temperature is rising always. Does your temperature have to rise for you to become sweaty like that?
Absolutely. No, but it is your body trying to regulate itself. So, in other words, it might be a response to the fever. Your body is kind of letting off some steam, to regulate its temperature. So the fact that you have, fever and chills, fever, sweats, and chills, that's we say that all the time. Let's see, physiologic, and they specifically menopause.
What are you looking at me for?
Not yet, Robin, but coming soon to a neighborhood near you. I used to work with a bunch of nurses, and they were all in their 50s, and I used to tease them. Can you imagine that?
No, shocking.
About a menopause support group, because they were always waving their hands on their faces. And I don't know if I would joke like that again. I don't want to upset someone. Here's a biggie. And a no-brainer, psychiatric disease, and the big A, anxiety. Generalized anxiety disorder, social anxiety. Somebody's got to do a presentation at work. And this is also a biggie as well. Substance abuse, narcotic withdrawal will classically cause sweaty. I think some people who are on chronic opioid medications for various reasons, even some of my Suboxone patients, might, when there's fluctuations, might seem to report this, but taking the medication that's prescribed should prevent that from happening. But when I try to talk to someone about having an opioid use disorder, and they're not quite understanding that these symptoms they have is really the cravings of opioids, sweatiness, and is kind of one of them. But physiologic is a big one. They said menopause, but I also think of just being young. Probably men more than women, but an adolescent or young adult having this problem. There's medications that may cause it, and this is a partial list. One is what are called selective serotonin reuptake inhibitors, SSRIs. Those are used very commonly, ironically, for anxiety. We just said that anxiety potentially causes it, and here we have a treatment that may be causing it. People have heard of all of these brands of this: Prozac, Zoloft, Paxil, Lexapro, citalopram, Celexa. The list is quite long. It's kind of a separate category, but not really. Venlafaxine, which is also known as Effexor, can do it. These are not used that commonly. What are called cholinergic agents, something called pyridostigmine, for example. That's also called Mestinon. That's classically used for someone with a disease called myasthenia. So unless you have myasthenia, you probably don't know much about that. But hypoglycemics, treatments for diabetes, insulin, sulfonylureas are old treatments, can do it. How about just hormones? Women can take a medicine called Avista, which is potential treatment for osteoporosis, and tamoxifen, which is a treatment for breast cancer. Those are kind of in the estrogen family, so they can kind of cause some sweating. Niacin. I don't know if anyone has ever been on that. That was used a lot, kind of to augment therapy, augment like cholesterol therapy. And I was placed on it for a brief time about 10 years ago. Niacin. I don't think it would be used now, but I remember having this happen to me. It was just a surge. I remember laying down on the bathroom because it's cool, waiting it out because I was the only, it was a peculiar experience. It only happened once or twice, and I don't know why. I think I would take the medicine at night, and I think I would probably sleep through it. But one night in particular, I was up and I experienced it, And interestingly enough, Viagra also can do it. All right, so what do you do about this? What if you have this problem of sweatiness? There's something that's used a lot. It's aluminum chloride. It's actually similar to what's in antiperspirants, although it's prescription strength. And what it does is it just takes your sweat glands and kind of ablates them, at least for a while, cause them close up and not function. There's a common brand of this called Drysol. So if someone has axillary sweat, armpits, that would be the treatment. If people really are not responding to that and it continues to be a problem, actually Botox is used.
So when are you just sweating just regularly, and when do you think that you might address it with a physician? I mean,
Right.
What's the difference?
What's a good point? Hey, if it's bugging you, you probably should address it. If someone says, Doc, I try to get through my day. Well, let's assume normal times when people are shaking hands. Some guy, we haven't really talked about when it's in the palm yet, but someone, they're selling cars or whatever. Well, every time they go to shake someone's hand, it's a little sweaty, a little clammy. I mean, that, makes them self-conscious. And or they need to do a presentation, or maybe think someone's a teacher. I talked about a professor I used to have, an attorney or someone who has to be in front of other people a lot, and is embarrassed to lift their arms up. I think it's very common and probably a big deal in young adults, people in their 20s and 30s. So anyway, for the armpit, you have that local treatment. So forehead sweating is also kind of common, and it's a similar treatment. But there's topical treatment and also the Botox. I guess the treatment's very similar for also in your palms and your plantar area. So the point is, this product called topical. 20%. She's laughing at me. Aluminum chloride is really the product. It was prescription. I don't know if it's prescription all the time anymore. I don't really prescribe it too much. And then usually what's second line for people really having resistant cases is Botox. And then there's some other treatments that are worth mentioning. So I just thought it was interesting to kind of bring up that topic. And, I think a lot of people maybe are putting up with this. And,
They don't have to.
I worked up a sweat talking about that one.
Phew.
Yes. Ooh, someone turned the temperature down in here. Well,
So just
Yes.
on the segue to prescriptions, this came up in our office, like how you said that, you said the effectiveness of the medication by the time it went through the prior auth process was already gone. You were using the flu as an example. But like this happens like all day long, every day in the office. I just think that it's just another important topic to bring up so that patients realize that this is the third person in the room causing the delay
Right.
in your ability to get the medication that the doctor wants you to have.
right, and actually, I think it was one of the first topics you and I talked about when we started to do the show, which is that the frustration that things like prior authorizations or formularies and formulary changes can cause to the patient and the healthcare provider who has written the prescription. You remember, and the dysfunctional nature of that relationship. How frequently, how the insurance companies or pharmaceutical plans love. I always say this. They love to say, we cannot approve this medication because your doctor did not give us the proper information. So the patient, of course, is going to be like,
What's wrong with that guy?
yeah, what's wrong with that guy? Well, remember, that guy prescribed it to you. So obviously he or she wants you to have the medicine. So already the logic of getting, a little peeved that the doctor is faulty.
Skewed, yeah.
Yes. So the doctor wants the medication prescribed. Why would I prescribe it and not want to prescribe,
Right. Well, I think it's important to also add that the doctor prescribed it and wants it to be covered. Like
Right.
the doctor doesn't want you to run into a roadblock with getting something covered.
Or a higher code. A lot of the insurance companies have formularies, and we see we kind of dread January because people's formularies change. So it's not unusual for someone who's been on one medication for a long time, a certain type of blood pressure medicine, and all of a sudden the insurance plan says, we're changing over to this one. You got to get a new script from your doctor, which, by the way, generates a lot of phone calls, a lot of, takes people kind of out of their cycle of their meds. I'm seeing, they're not going to need a refill until March or whatever. Anyway, so it's frustrating. and then the list of meds that have required prior auth has increased over the years. And even the antibiotics, okay? So, which really was and generics. To me, okay, the prior auth was for the big shot, fancy, new medication. All of a sudden, we're getting the prior auths for non brand name for generic medication.
And for a layman, when you say prior authorizations, can you explain that a little better? When you tell a patient, well, this medicine's requiring a prior authorization, what does that mean?
What does that mean? Well, first of all, it's frustrating because it's redundant. In a way, I have already written the script, so I have already authorized it. So the prior auth is your insurance company. Usually, it could be either your insurance company directly or your insurance company through a pharmacy plan. A lot of people on Medicare, for example, have pharmacy plans. Has decided that medication they're not going to approve right away. I have to kind of make the case for it. Why this medicine?
Prove it.
Prove it. They'll say things like, has the patient been on this first? And it's frustrating sometimes because people can be on it's frustrating many times, but people can be on a medication for a long time, and all of a sudden the pharmaceutical plan now wants to know why. And I have to dig back in a chart. Well, they want to know why something doesn't work. It's something else. Why they can't take something else.
The cheaper medication.
Whatever, yeah.
I think it's important to point that out.
Yeah, there's one. The pharmaceutical. No, it's not the pharmaceutical industry. Remember, they want to use their products. So no, this is your insurance plan and your prescription plans. They will say that they're concerned about your safety, that they want to make sure the doctors are prescribing this medication appropriately. I'm getting a lot of concerns about some elderly people and some meds they're on. But their number one goal is really to spend as little money as possible. So all those other reasons are just smoke.
Legitimate.
Yeah.
But at the end of the day, it's about which medication costs them less.
Yes. Right. So it's smoke. And it's frustrating. We talk diabetes is a big topic, okay? And it's interesting. I was digging through some old med school books and kind of feeling really old because when I look at some textbooks and I see what they're explaining as treatments are barely used today. So this one was
You showed me it was like a page and a half.
Yeah. It was a pharmacology review book. So it's not really a textbook. It was really meant like when you were to be used like when you were preparing for an exam. But the section on diabetes was like 2 pages. It talked about insulin, these things called sulfonylureas like glipizide and glucotrol. Some people are still on them, but and then it barely mentioned metformin, which is metformin is used a lot now. Metformin was being it's complicated, being reintroduced to the market in the mid '90s in the United States. But there have been so many new treatments. All you got to do is turn on the television and watch a couple minutes of nighttime news, and you'll see one ad after the other. And one of our big frustrations is we have these new treatments, and actually some of them are really good treatments, but it's one roadblock after another to get them covered. Now, sometimes they are covered in quotes, but the cost can still be significant to the patient.
Cost prohibitive, actually.
Yeah. Cost prohibitive. So we feel like our hands are tied. We feel that, one side where doctors are not treating aggressively enough, that A1C should be lower, and then we feel like
hey, there's this great new medication that would really, really help this patient, but they can't get it approved and they can't pay for it.
Right. Yeah, you got it. And it's I work a colleague of mine. I work closely with an endocrinologist. She's been on the show, Dr. Batamosi. I mean, unfortunately, a good part of what her staff does is get these meds authorized. That's kind of, dominates the dojo.
Right. It's just important for the patient to understand that this is it's like a fight. Like the doctor is fighting for you.
That's right.
And sometimes you just can't fight anymore.
Right, and sometimes they play games. They'll say the doctor hasn't faxed us any information. I mean, and in our, we clearly have faxed the information. If they want to, and we will fax it again. But that's one of the oldest tricks in the book. And
so the idea that a patient has to try a medication that the doctor didn't prescribe, that the doctor didn't want the patient to have, but the insurance company says they should try this medication and fail on it first.
Right.
So that means they have to take it and not do well.
Yeah.
I mean, you throw your hands in the air. You're like, really?
There's another side to the story. Sometimes when you ask people, you look at someone's allergy list, and then when you try to ask a few questions about why a certain medication is on their allergy list, you don't get much of an answer. They took it once and felt a little dizzy, or something like that. So there are times where I say, what, your insurance company wants you to try this medicine again, and you got to do it.
If you want it covered.
There are times where I refer the patient to a specialist, because I can't get what I think is best for them covered. I am failing. So I say, if they're not going to listen to me, maybe they'll listen to an endocrinologist or a rheumatologist or a neurologist. And, I feel like
Really ties your hands, huh?
it's very frustrating because we're also kind of graded on how well we do with managing diabetes. And we feel that, I don't know, it's just jerking us around. One hand, it's kind of like, all right, we'll try to do better, get people under better control. But on the other hand, you're not giving us the tools to do it. And then insurance companies are also vague a lot of times about how much they cover things like a dietitian, for example. And we've talked about that before. Maybe there's been some improvement there, but there have been plenty of time. One insurance company in particular, I kept referring the patient to a dietitian. And finally I spoke to them directly, and they said, we don't have a dietitian. And I said, well, who's supposed to counsel them? They say, we feel the primary care doctor should. So they think it's my job, which is insulting, by the way, to nutritionists and dietitians and their years of training and skill. I mean, it's a rather complicated topic and totally unrealistic as to the time that I have. Frustrating.
Yeah, amazing.
All right, well, we got into that topic. We're going to meet after the break.
Birthdays.
Let's see what we got.
All right.
It's birthdays.
We'll be right back.
Okay, thank you, Dr. Eric Stanberg and Robin Baker. Thank you so much for hosting this last portion of Kingston Community Radio. KCR is Kingston Community Radio, WGHQ, AM 920 and 92.5 FM. 8 o'clock a.m., Monday, December 14th, 36 degrees. This last portion of Kingston Community Radio was brought to you by Central Hudson. 85% chance of snow first and then rain this morning, changing to all rain later in the afternoon. High of 36. Tonight, some clouds, low down to 27. Tuesday, clouds and sunshine alternating with a high of 34. Tuesday night, a few clouds, low down to 15. Wednesday, cloudy, snow developing in the afternoon, a 40% chance of snow during Wednesday. High of 27, and then Wednesday night, monitoring a potential winter storm. Periods of snow, 72% chance of snow, and a possible 8 to 12 inches. And, of course, that varies in various areas, up in the mountains, down in the valleys. And we'll be right back.
You're listening to Kingston Community Radio on WGHQ Kingston. On your radio at 920 AM and 92.5 FM, and also online at mykcr.org.
As the world faces the challenges of the ongoing COVID-19 pandemic, Lions recognize that kindness matters now more than ever. And Lions and Leos are finding ways to continue to serve our communities. For more than 100 years, in times of need, Lions always find a way to help those around them. And after we emerge from this, we will be stronger than ever. Visit lionsclubs.org to learn more.
Do you go all out decorating for the holidays? Snap a photo of your home's decorations and you could win $500. Enter Central Hudson's Holiday Spirit Photo Contest today. If your photo gets the most likes on our Instagram page, you win. Deadline to enter is noon on December 11th. For contest rules and information on how to submit your photo, go to Central Hudson's Instagram page, central_Hudson, or visit centralhudson.com.
This is Greg Chorvis, and once again, the WGHQ Happy Christmas Fund is asking you to help the needy this holiday season. For the last 50 years, the WGHQ Happy Christmas Fund has helped less fortunate families have a happier holiday. Look for our collection boxes at the local branches of the Ulster Federal Credit Union, Rondout Savings Bank, the Mid-Hudson Valley Federal Credit Union, Ulster Savings Bank, and at the Kiwanis Ice Arena in Sorges. Thank you very much, and have a happy and Merry Christmas.
And thank you for being with us here at KCR, Kingston Community Radio, AM 920 and 92.5 FM. Monday, December 14th, and 36 degrees here in Uptown Kingston. The upcoming segment of KCR is brought to you by Herzog's. At Herzog's, home and paint centers, community, family, neighborhood, all matter. Herzog's employees have been a part of the Herzog's family for years, valuing personal customer service and being close to the community. Stop by Herzog's Home and Paint Center in the Kingston Plaza for all of your home building and maintenance and painting and Christmas needs. Discover the difference of buying local. When you get your Christmas tree from Herzog's Christmas Tree Lot, you provide funds to the Girls and Boys Club of Ulster County. So it's a great plaza there with many choices of Christmas trees. Enjoy. Let's get back to the on-air studio with Dr. Eric Stanberg and Robin Baker. Welcome back.
All right, thank you. Thank you, Dan. Welcome to the second half of this morning's show, and thank you to Herzog's for being a sponsor.
Thank you, Herzog's.
Yes. Anyway, well, what do you think, Robin? What time is it?
It's birthday time.
All right. So let's see how many entrants we have. Oh, we have 2. So the competition is deep. Let's get ready. Of course, we could have done this during the break. All right, here you go.
All right.
Let's see who sponsors this and then what we're...
The Boyce Dairy Milk House on 62 O'Neill Street in Kingston. The winner of today's birthday is going to win a famous cow pie.
Famous cow pie.
You ever had a famous cow pie?
I've had a notorious cow pie. An infamous cow pie.
So it's like an ice cream pie, and you get to kind of make it up as you go. You can choose what ice creams you want, what toppings. Sounds delicious, doesn't it?
Yes.
All right, so this is Monday, December 14th. Wish a happy birthday to Florence Jones. This is from your friends at the Town of Ulster Senior Club. And also, December 14th, happy birthday to Maureen Rahili from your friends at the Friendship Bible Coffee. So happy birthday to Florence and Maureen. And here is the big drum roll for our winner for today is Florence Jones. Florence, you can stop by Boyce Dairy Milk House, 62 O'Neill Street, and claim your prize. Congratulations.
Yes. Congratulations.
Is it too
Florence.
Is it ever too cold for Boyce's ice cream? I don't think so.
Well,
I
you
don't
eat it
think so.
outside. You gave it-
Right, we probably wouldn't eat it outside today, but
a lot of people have homes that are so hot. They get the wood stoves going.
what's wrong with that? It's nice and warm inside.
Sweaty. We were already talking about that. By the way, I can't believe the list that I read left off one common cause of sweatiness.
Which is coffee?
Coffee, our over-caffeinated society that we live in, yes.
Huh.
Well, we do have a guest, I think.
Going to be joining us in just a
Yes,
few
okay.
minutes.
So in the meantime, what should we talk about?
Well, what are you experiencing? I mean, you were at urgent care yesterday. What's trending in medicine right now,
COVID testing.
right?
COVID.
And the reasons, are people really symptomatic, or are people just in need of tests because they have to do something else like travel or
Both.
get a procedure done? Are you hearing anything on procedures? I haven't heard anything as far
Like
as
shutting them down.
Yeah.
I've not heard that.
I feel like the hospitals are, they've learned so much. Everyone, all of us have learned so much since this started, that they are really just so prepared to be safe in those situations that
Yeah.
I don't think people have to be afraid if they have, they're having a procedure done. I think they should feel confident in the hospital's ability to take care of them and take care of them safely.
Yes, I agree with that. The work that they do every day, just tremendous.
And it's not easy. I mean, if you can imagine, any of us doing any of our regular day jobs, like even us sitting here in the studio today and Dan in the control room, we're sitting far apart. We're not having to wear a mask or a shield or anything, but this is all day, every day in the hospital with a mask, goggles, a shield, gowns, gloves. You're just completely,
Yeah, no, you're
covered
right
up.
about the goggles. There are concerns that transmission can go through the eyes. So protective eyewear is also being recommended.
Yep. We have a new test at our office. Do you guys have this at urgent care? The self-administered test. That's what we're using at this point.
Nasal swab, and you just kind
Yep.
of send it out. Yes.
Yep. So 10 swirls in each side, and the patient does it themselves. And
That's called I think it's called the BioFire test, which runs a lot of things in the office, including a COVID screen. So that's
what do you mean a lot of things in the office?
like flu and a lot of other viruses.
So it's a multi-virus test, and it'll tell you which virus you have?
Yes.
You have that at your office?
No,
Where-
but I some other offices do. It's complicated.
So which ones? Because I'm going to get calls today.
I don't know if I want to say.
I want to be tested for everything.
Well, it's a product. It's called the BioFire. It's not a good name, but it's an office administered test that tests for a lot of things.
Yeah, Dr. Tack was actually talking about that a few weeks ago, that was being developed.
The problems with it, the problem's simple. I mean, I don't know how much it is, and I don't know whether your insurance plan is going to cover it. I do think, other than that, I think it's a great test. But, it's just a way, it's very helpful. All right, we do have a caller. So, good morning.
Good morning, Dr. Steinberg. How are you?
Good, okay. This is Dr. Ken Hansraj. Let me tell you about Ken Hansraj.
Here we go.
I've known Ken for 20 plus years. He's been working in the Hudson Valley out of Poughkeepsie as a spine surgeon, a spine specialist with the neck and lower back. Usually, I will say, as a patient of his as well, that this is not a doctor this is a doctor who approaches the problem from all angles. This is not someone who just kind of wants to do a procedure on you and ship you out. The way he approaches his practice is to help people with their spinal health. And anyway, so he's joined us this morning. Good morning. How are you, Ken?
I'm good. Good. How are you? What's new in Kingston?
I usually start the interviews by just asking a little bit about you, a little background on you. Like, when did you come to town?
Oh gosh, so long ago. 97. I came in 97.
97. All right. And he says, you're a veteran. I know that feeling right now. I was sitting at a meeting not that long ago saying, wait a minute.
I'm the old guy here.
The old guy here. How'd that happen? How are things going overall with your practice?
Things are good. We're busy. There are lots of people with back pain. And Eric, you'd be amazed. There are more people suffering now with COVID-19 because they're stuck at home and they're not able to get out and take care of themselves and move their spine joints. So they're more in pain.
Right. So what would you, this is such a huge topic, and certainly it's in primary care. I worked urgent care yesterday. There were a few people with acute back problems. Why? Why is this such a source of problems and trouble for us?
So, Eric, from my heart, really, from my mind's heart, we all have spine joints, and people are not aware that they have these beautiful jewels called facet joints, and you have 24 pairs. And every time you move, you move your neck forward or backwards, it's by the grace of the spine joints. And now, when we're locked down, the joints are not moving, and they start to hurt. That's mainly why right now. That's a very topical reason right now in COVID.
So generally you think that just more physical activity keeps our neck and backs healthy?
Yeah, move. I tell my patients, just move. There's studies that show that if you get up and you fold clothes and you walk upstairs and you do the laundry and you do some dishes and you get up, you get around, in 2 hours, your body is metabolically shifted. Its spine is a different spine. It's ready to do more. The spine becomes conditioned. So I tell my patients that they need to be wary, that they have a spine and they need to take care of it, warm it up, and show some love to it.
Okay. So that's one message, right, is that we all have to have healthier lifestyles. What about I don't know. I mean, it's just such a common problem for someone to bring it up to me. Either actually a lot of times in primary care comes up as part of a wellness visit. Someone talks about a neck or back problem. Let's talk about. We'll just start with the top, I guess, the neck. I mean, I don't know. Where should we even begin to try to help a patient who's reporting problems with their neck, and maybe they have symptoms going down their arms?
So typically, right, a patient shows up with neck pain and arm pain. And again, the number one thing you can do is become aware that you have a neck. People are just, they magically forget about the spine. They think ignorance is bliss. But you have a spine, and it's a beautiful, beautiful thing. The spine carries the spinal cord, which every time you hug someone or you hold someone or you write, every time you walk, every time you move, it's by grace of the beautiful spinal cord and the nerve roots. And we need to think about it and think about how to service it. We started your interview with move. Move is such a beautiful message. Just start moving. Another great strategy is start your day with a long, hot shower, which just just heats up the joints and gets it ready to go. Like warming up your car.
All right.
It's a nice way to put it.
Well, we warm up our cars. We probably should warm up our bodies.
What's the difference between chronic back pain and like acute back pain? Like I hear people throwing their back out.
Yeah, that's but can I preface that we're about to have a snowstorm, and it's every ER will tell you about a couple visits that come in with the shoveling of someone who's hurt their back while shoveling the first storm of the season.
Right. So an acute back pain. Your first question. I'll take yours next, Eric. So the acuteness means that it's new. Acute means new. Doesn't mean that it's cute or it's good looking. It means new. Chronic is, forever. Chronic is forever. And Eric, you talk about really people getting out without being warmed up, without dressing properly, and getting out and lifting. And the biggest mistake is to bend over and lift. The way I describe it for my people is that think of your thighs as shock absorbers, right? So bend your knees, not your waist. Bend your knees and use your thighs, these great thigh muscles, as power lifters to lift the snow. And then you'll definitely stay out of trouble. And then the warmer the thigh muscles, the quadriceps and the hamstrings, the warmer they get, the more you can lift and the better you feel. And you're not stressing your back. And you're not going to see the ER doctor.
Okay.
Yeah, makes sense.
So if someone does throw their back out, again, they call me as well. What would you, what should we tell them? That's a very good question. Because should people lay on the couch for 3 days while they threw their back out, or should they try to move?
Move is the answer. Move. Yeah. So if someone acutely, as we diagnose it acutely, which is a new injury, calls you and say, I have back pain, and typically like 99% it will resolve. And so typically I would say, hey, get up and start doing the micro motions. Get up, move around the house, upstairs, downstairs, take a long hot shower, a few Advils. That right there would probably cut the pain 60%.
Okay, well that's take-home message number one, which is to not let an acute back problem keep you out of, on the couch for a couple of days. Moving is better than not moving. All right, well, that's one take-home message.
Right.
What about this entity known as sciatica? A lot of people, say they have that. How would you explain that?
So sciatica, or the very famous sciatic nerve, as I like to describe it. The sciatic nerve is a conglomeration of nerves that have exited the spine and are traveling together. The sciatic is the grand central station of nerves. Then they run down to the legs, and they run the hamstrings and the quadriceps and the calves and the toes and all of that. But the sciatica typically gets stuck as it exits the buttocks by a muscle called a piriformis. And again, it's a motion thing. And I would say, hey, if someone called me and said, Eric, they said, hey, I have sciatica and I'm your best friend, what do I do right away? My number one go-to is called a pigeon stretch. And the pigeon stretch is you put your knee in front of, like on a high table, and then you tilt it in 45 degrees. You push it over 45 degrees, and you lean over, and then you incrementally stretch and stretch and stretch a sciatic nerve. And sometimes, and most times, that release is all you need, just stretching the sciatic nerve. And if you're having a problem understanding what the pigeon is, look it up online. There are lots of beautiful boys and girls that are explaining it.
The pigeon stretch.
The pigeon stretch.
All right, so sciatica. And what are the common symptoms of sciatica? Like, how would a patient describe it?
Well, typically you start with butt pain, right? Pain in the butt, and that's sciatica. And then it could become much more serious. So you can get, if the nerves get more involved, you can get numbness and weakness. And sometimes the sciatic translates to serious problems like what's called a drop foot. where the foot doesn't lift up and you're unable to walk well. So sciatica is a whole big manifestation
Right.
of symptoms. Yep.
I think there's a lot of confusion even amongst maybe, for the physician community about what exactly is sciatica. I think they think it's a prison in upstate New York. I just wanted to make that joke. All right, anyway. So if someone has sciatica, other than telling them to kind of get moving, nice hot shower, some pigeon breast stretching, are there any medications that we would recommend to them?
I would start with Advil, Aleve. I would expect to get better. The nerve wants, if you start showing some love to the sciatic nerve, it responds quickly. And absolutely the wrong thing to do is to sit down and stay stuck. Because when you stay stuck in motion, then the nerve gets stuck. And then you'll really, truly understand pain.
Okay. All right. Well, so, other meds, and I'm kind of asking for myself as much as well as for people that might be listening. Do you think muscle relaxants help?
So I love to do, my favorite go-to, Eric, is I love to give an anti-inflammatory in the morning to help you and get you going. And I love to give the lowest dose of gabapentin at night. So gabapentin is a medication that helps the chemistry of the nerve, the biology of the nerve. Gabapentin will help that nerve, but it also helps you to sleep a little bit, because I find that a lot of people that have back pain or neck pain or arm pain, they develop a component of anxiety. They start to worry, hey, am I going to feed my family of 22? They start to really worry, and the worrying makes things worse. So the gabapentin helps you to sleep a little bit. Same reason I give a long hot shower. You sleep a little bit better and you feel better through the day and you're able to do more. I start with an anti-inflammatory and I end with gabapentin at night.
All right. So not much role for muscle relaxants. And certainly, something that's been in the news a lot, we talked a lot about this show a lot, of, the role of opioids as well is really not recommended.
So let's do muscle relaxants, right? So some people progress and have much more difficult situations, and they need much more help. So in my mind's eye, muscle relaxants are not really muscle relaxants because mainly they work on the brain, and they dull you. And so muscle relaxants helps with spasms and when symptoms get heavier and heavier and you can't move and it's just hurting, a muscle relaxant may be employed. And similarly, when the pain is so severe, very rarely now do we recommend narcotics, but we do sometimes recommend narcotics, and we do the lower grade and lower doses of narcotics, because mainly there's so many options with heat and modalities and hot packs and cold packs and long hot showers and motion and stretches, and especially the pigeon stretch, to get going again without going to the narcotic.
Okay. What about, kind of when people have symptoms that go down their arms, cause their fingers to get numb, or down their toes, numbness, what we would call it a radiculopathy. Is that something that people should be a little more concerned about, or is the treatment initially the same?
So the nerves are amazing, Eric. You would love the characterization in my mind is so amazing. If you can cut my head open and take a look at what I think of nerves, they're really miraculous. They're amazing. And nerves given half a chance, don't cut my head open.
Okay.
But nerves given half a chance will heal themselves. Even nerves that are compressed. People with herniated disc, for example, let's say a common level C5, C6, herniation right side C5, C6 with numbness and pain to the right thumb. Well, if you avoid bending and lifting and twisting, and especially reaching, if you take long hot showers, if you do some anti-inflammatories, you sleep properly, and here's a big component we haven't covered yet. If you do deep belly breathing, then the nerve just calms down. Even though it's tight, it calms down. And so the numbness could go, the weakness could go, the pain would go. So the nerves are very forgiving.
Oh, it's good. Good. These are all good points. What about the role of other treatments like physical therapy, acupuncture, chiropractors? Are these things that you find helpful for patients?
They're all extremely helpful. Eric, back pain is ubiquitous. Yeah, back pain is global. The global cost for back pain is $300 to $500 billion per year globally. And I'm writing a new book. Here's a new factor that's astounding. By 2100, we may have 11 billion people, and when it's 11 billion people, the back pain cost may be $1 trillion per year globally. So there is so much back pain, and so our helpers, the osteopaths, the chiropractors, the acupuncturists. So an osteopath is more generally a softer manipulator of those beautiful facet joints, and they tend to work with the myofascia, which is the deep tissues in the body, just to relax it. Osteopaths have a treatment which I love so much called Cranial Osteopathy, where they hold your head in their hands and they induce a deep, profound relaxation, and all the pain just recedes. It's just amazing. Chiropractors are predominantly facet-based work, so they'll move the facet joint, and when they do, the joint gets better. Not only that, underneath the joint, the nerve exits, so the joint gets better and the nerve gets better. Acupuncture works by meridians, and I'm not quite sure exactly how it works, but people love acupuncture. It just helps. So all of these treatments are really there to help and to massage and to really calm down the nerves from the world that is suffering at all times with neck and back pain.
Okay. A lot of times, it's very common for somebody to come into my office with a neck or back problem and, ask for imaging, an X-ray or an MRI. What do you think that is appropriate?
So, if more than likely, I say to people, look, if you have a back, you have a really high chance of having some pain. So let's try some things. Let's maybe try a round of physical therapy. The physical therapists are amazing with their hot packs and stim. It's magical for the back. And more than likely, the pain goes away in 2 weeks and 3 weeks. If the pain does not go away, then you need an MRI and X-rays right away. Or if you have severe motor deficit, that is, like if you have a drop foot, or if you're dropping things from the hand, if you have weakness, tremendous weakness, or if you have numbness that bothers you all day, or if you can't walk. And certainly, our only emergency is if you're starting to lose control of your bowel and bladder, you need to be seen in the emergency room right away. It might be a surgical emergency.
Right. That's right. That's the cauda equina syndrome.
Exactly.
Right.
Yes.
All right. So the take-home point from what you just said is that imaging really does not need to be done right away. People should try it came up just yesterday in urgent care with somebody with some neck pain, and I recommended against doing even an X-ray. I said, I think patient about 60 years old. I said it's going to show probably a little arthritis, but it's not going to help at all with our treatment right now. And she agreed with that. And some of the big shots that kind of regulate the good decisions about how we do things recommend against routine X-rays for back and neck pain.
Though, I'll say this. I'm a spine specialist, Eric. And by the time someone comes to me, by the time someone makes it to me, I think they have suffered so much. No one comes to me to say, I heard you're a nice guy. When people come to me, they have suffered a tremendous amount. So whenever anyone comes to me, I image immediately. And having so much experience, I've found things that sometimes are scary. Sometimes I've found tumors and and infections. And so by the time someone comes to me, a true spine specialist
Right.
that does nothing else, I always image.
Yeah, and that's true. We actually have to have a quick break. Do you want to stay on after the break?
Yeah, if
All
you
right.
wish.
All right, then I think we got a word from our sponsors.
Yeah.
Be right.
Okay, thank you, folks. Thank you, Dr. Eric Stanberg. Thank you, Robin Baker, and a very, very special thanks to Dr. Ken Hazarat, a spine specialist, who will be back with us in just a couple minutes. You are listening to KCR, Kingston Community Radio, WGHQ, 920 AM, 92.5 FM, and we are at the bottom of the hour. It's 8:30 AM, Monday, December 14th, 36 degrees here in Uptown Kingston. And this last portion of Kingston Community Radio was brought to you by Herzog's. Herzog's color decorating consultants and expert interior designers are always there, ready to assist you in choosing the right colors. Visit Herzog's in the Kingston Plaza, and while you're there, in their plaza, right outside, when you get your Christmas tree from Herzog's Christmas tree lot, you provide funds to the Girls and Boys Club of Ulster County. Visit Herzog's in the Kingston Plaza, and sales are ongoing at herzogs.com. Mid-Hudson Valley weather and forecast one more time for today. 85% chance of snow, and then rain later as it warms up today. It is snowing now in Uptown Kingston. It's a high of 36 degrees today. Tonight, some clouds, a low of 27. Tuesday, clouds and sunshine alternating with a high of 34. Tuesday night, a few clouds, low down to 15. And Wednesday, cloudy, snow developing in the afternoon, 40% chance, and a high of 27. Wednesday night, monitoring a potential winter storm, periods of snow, 72% chance of snow, possible 8 to 12 inches Wednesday night. We'll be right back.
You're listening to Kingston Community Radio on WGHQ Kingston. On your radio at 920 AM and 92.5 FM, and also online at mykcr.org.
We are Lions. We bring hope where it's needed, support causes that matter, change lives, change communities, change the world. Visit lionsclubs.org to learn more.
If you came across someone struggling with hunger, how would you recognize them?
By their clothes,
their age,
the way they speak. Hunger can be hard to recognize. Learn why at IamHungerInAmerica.org. Brought to you by Feeding America, 200 Food Banks Strong, and the Ad Council.
Do you love the festive decorations and colorful lights of the holiday season? Visit Central Hudson's Instagram page, Central_Hudson, to vote for your favorite photo capturing the best decorated home in the Hudson Valley. Be sure to follow our Instagram page so that you may choose your favorite photo. Hurry, voting ends at noon on Wednesday, December 30th.
Hi, my name is George Post from Ulster Park, New York, and I support Kingston Community Radio, and so should you. Where else can you speak to your local representatives on the air and have your questions answered? So thank you, and support KCR.
And you are with us at KCR, Kingston Community Radio, airing on WGHQ 920 on your AM dial, 92.5 FM, and streaming online at mykcr.org. And our talk radio call-in number is 331-9255. This upcoming portion of Kingston Community Radio is brought to you by Ulster Savings Bank. Many locations throughout the Mid-Hudson Valley, locations near you. Let's get back to the on-air studio with Dr. Eric Stanberg and Robin Baker and our guest. Welcome back.
Thank you. We are on the phone with Dr. Ken Hansraj. He is a spinal surgeon, works out of Poughkeepsie, and we're just kind of having a general conversation about neck and back problems. And we've a couple of interesting takeaways, which is that the spine is a beautiful thing. And then
I love that.
Yes, and the importance of just being active and moving, and the importance of really taking care of ourselves and our back to help these symptoms, and to not allow neck and back problems to put us on a cycle of less activity, because more is the way to do it.
Dr. Hansraj, how important is your core to your spine?
Oh, that's amazing. I have a great story for you. So, Eric, it's amazing you have your Robin. I'm not going any further than that, but Howard
you.
Stern comes to mind. But I'll leave that alone.
Oh,
as
yes,
is.
yes. This is the family show.
I'm done with that concept. So, Robin, your question is, how important is the core, right? So I have a way of showing my patients and talking to them about the core. And so you think you'd love this. So if you see somebody beautiful, right, Robin, man or woman, you say, wow, that person's got great abs, just amazing abs. You can see the 6-pack or 12-pack abs. And you can say, hey, that person's got buns of steel. And those are the external core. The internal core is are really the most important, which is exactly the psoas muscle. And so the psoas muscle is, if you look at it on MRI scan, to me it tells me how long you'll live and how well you'll live.
Wow.
So you've mentioned two muscles so far, the piriformis and the psoas muscle. So these come up a lot. The chiropractors will talk about it. Osteopaths, the specialists like Dr. Hans Raj. So those are two muscles probably worth looking up.
Right. The psoas muscle is amazing. And it'll tell you, to me, I can tell right away. I can tell you a funny story. I saw two brothers in consult. And they're both muscular, but one of them had amazing psoas muscle and the other didn't. And I was seeing them side by side, and so it created for great humor in the office. But the psoas muscle is so very important. It's your innermost core muscle. It's right next to the spine, and it will help you to stand erect, especially as you get older. And so the psoas muscle is a great indicator of life for me. And the way to build it, and I've seen, the way to build it is to do planking. If you do like a minute of planking a day, you're working on your psoas muscle. And if you do, if you do a minute per day for a year, the psoas muscle will become 3 times bigger. It's amazing. It's so plastic. It changes.
Okay. So when do you think people should come see you? I always look at a guy like myself, and trying to take care of patients. When should I? What type of patients you like to see get referred by their primary care doctors?
So the primary care physicians, who are really, it's such a mothering role. They're taking care of all of these people. And so the primary care physicians are well aware to take care of the people and tell them, look, right now you don't even need an x-ray, you don't need an MRI scan, you just need some loving, tender care to the back or to the neck. And if they come back in 3 weeks and they're no better or they're worsening, then you may send them on to get an MRI, x-rays, and maybe I could recommend pain management and so on.
Okay. I appreciate that. And these questions come up a lot with various patients and how to direct them. You find that other physicians kind of, almost like a team approach. You mentioned pain management specialists, and treatments that they can provide, right? Are there some colleagues locally that you want to mention?
So right there, right in Kingston, you have Elvis Rima. He's amazing. And, of course, the Orthopedic Associates of Dutchess County have their guys.
Sure.
I'm not quite sure who they have, but you have options in Kingston right locally, and the guys are really good. I mean, I would say anyone that's done 5,000 or 10,000 injections are amazing, and that's what the guys have done. They're quite experienced.
Yeah. Okay. Well, Dr. Elvis Rima, and actually, I know who he is, and he was around. I wasn't quite aware he had an office in Kingston, so we're gonna have to reach out to him and
refer some patients over.
Yeah. Yeah, and that was great. By the way, I am also a patient of Dr. Hans Raj's. I was just there last week with some low back pain, particularly radiating down my hip and into my leg, and we're doing conservative treatment. He talked about all this stuff, the Pigeon Stretch and importance of breathing, and
we've been working on your deep breathing.
I have been working on my deep breathing.
Deep breathing is actually harder than you think.
Yes.
Robin, I don't know you. Can you please tell me who you are? I just don't know you yet.
Dr. Rima, I'm the patient perspective on the show. So I'm just a layman, and I'm here
You're a lay
to
person.
facilitate the conversation between the doctors, kind of when doctors get in their doctor speak, and those of us in the audience have a hard time understanding what they're saying. I'm
Robin,
here.
let me take the lead for a moment. I heard you say something near and dear to me, which is breathing. Please explain to us the importance of the breath.
Can I also say that Robin is a wonderful singer? So she also talks about how important breathing is to be a vocalist.
Right. Being vocally trained, it is like working out. You have to have enough air to be able to sing, and it was one of the earliest things I was taught in my vocal training is how to, how to fill up with air to be able to get the sound out.
We're always talking about the diaphragm.
You have to think about it, because your breathing is unconscious. It just happens, right? We're breathing right now. We're not thinking about it. But when you really give thought and depth to your breathing, it changes everything.
So Robin is my friend and colleague and partner. And she does, first of all, she has a lovely radio voice. And she's a singer. And she does help kind of keep the conversation going. When I tend to ramble and when guests tend to get, into doctor jargon.
It's technical.
Yeah, although Dr. Hans Raj is not really engaging in that at all.
No, I love how beautiful he speaks.
Eloquent. By the way,
Robin,
yes.
Go ahead.
Go ahead, Ken.
So, Robin, you'd be amazed, right? One of the things I teach most of my patients is the importance of deep belly breathing, right? And so I use the belly, not me. I mean, these are world ancient techniques of using various body parts to augment other body parts. So I taught Eric, I said, put your hands on your chest and put your hand on your belly and feel your belly rise as you breathe in. And I teach the 5 steps in, like, I don't know if you can hear that. And then I teach the 5 steps out. And the belly goes up and the belly goes down. And so then the belly, when it goes up, it pulls the lungs down and expands the lungs. And when the belly goes in, it pushes the lungs up. So you get deeper in breathing and more clearance of the lungs and more oxygenation eventually.
Which is good for the spine?
Furthermore, Robin, when you do deep belly breathing, the studies are saying that you're moving the spinal nerves and the spinal channel, and that's massaging those nerves in my mind's eye. So, Robin, when we're in surgery, right, and we're operating in the spinal canal, if we ask the anesthesiologist to do a machine-based deep breath, and we breathe deeply, we see the spinal cord and the canal, the sac inflate, and we see the nerves move. So there's a whole concept of nerve mobility and nerve massaging with deep belly breathing. How cool is that?
That's awesome. Never heard it described so eloquently.
So, Dr. Hans Raj, you've also written a couple books, right?
Yeah.
Are they the one that I have is, I think it's called Secrets of the Cervical Spine?
Yes, that's one of my secrets, deep belly breathing.
And so these books are available, right? Are they, kind of Amazon? Yeah. All right. And, all right, so...
What a lovely holiday gift would that would be.
When do you think someone needs to have surgery? What are some of the common reasons where, it's just time to operate on the patient?
Well, sometimes patients have very large, for example, herniated discs, right? And trying all conservative treatments does not help. Or if they have neurological deficits, they're unable to walk, and they stumble, and they're unable to work, then I would say clean it up. We can decompress that nerve by cleaning up the disc, and usually they're tremendously better. Sometimes, that's a whole book unto itself. Well, one of the things I love doing, Eric, is what do you do? And and Robin, of course. And what do you do when someone has had major surgeries and they still have pain? And we have some surgical strategies for that.
Hey, before we get to that, we actually have a caller. So
Yes, and it's a caller who just wanted me to relay the question, and it seems quite a kismet here about discs and how to ameliorate situations with slip discs or discs without the cartilage in it and that kind of a thing. I guess as you were talking about chronic situations,
right.
that's what he seems to be referring to.
Okay, so what do you think? We haven't really even mentioned disc yet, and a lot of it comes up a lot. People have a slip disc, herniated disc. So
What does that mean?
Yeah.
So in the human spine, we have bones and discs. The discs are the shock absorbers.
Right.
God designed the discs so that there are layers of walls that protect the inside, which is the main shock absorber. But sometimes with wear and tear and doing the things we do, we get cracks on the annulus, which is the protective layer. And when we get a crack, then the inside pops out. That's a herniated disc, or popularly known as a slip disc.
Okay. And again, one thing, and I tell this to my patients, just because someone maybe already had the MRI and it showed a herniated disc does not mean they need surgery. They still should, try treatments other than surgery. Although, I guess, as you mentioned, though, sometimes the disc fragment is so large that the best option for the patient is to remove it. Do you agree with that?
Yes, absolutely. And sometimes it's vitally and absolutely necessary immediately, but not often.
Right. As a primary care doctor, I sometimes, to me, if something is maybe specific, I say, yeah, that's a herniated disc. It's looks, and I go with the radiology report. That's another point I guess I want to make is that radiologists are training to read the films, but so does a doctor like Dr. Hans Raj, and occasionally there's kind of some disagreement about how severe something might be, or things that maybe Dr. Hans Raj sees that the radiologist might not see, and that's just part of medicine. That's why two people look at the films.
Two heads are better
Right.
than one.
Yeah.
So that's common as well. I mean, it just happened to me, by the way, whereas I had an MRI that showed, used the word severe, which is an alarming word to see. And then after consultation with Dr. Hans Raj, he did not feel it was severe. That it was something that we're going to try to treat without going down the surgical route. But that being also said, to also say that I walk the walk around here. Dr. Hans Raj recently operated on my son, Sam, and a 19-year-old, who probably hurt his back playing football, but then, kind of excessive muscle training and stuff like that.
Aggravated it.
Yeah, he's probably not happy. If he's not listening, he's probably still fast asleep. He would not be happy to hear me say that because he doesn't want to blame his exercise technique. But we did
Sam's
talk.
an amazing kid. I love Sam.
Thank you. He is a good kid. He's a special kid too. All right, so you were available.
Wait.
Yes.
My wife corrects me. Let me do that. In my heart, he's a kid, and I love him, but he's 19. He's a big man, and he's big. He's bigger than I am, so there.
Right. He's, I say to my kids, I have a 25-year-old. My daughter's going to be 24 next week, and then Sam's 19. I say my work with you is just beginning.
Yeah.
They don't really like that very much. But I say now is when you really can make some bad decisions. So your father's still here.
Yeah.
You think they find that funny, Robin?
Probably not.
Well, say hi to your wife for me as well, Marcia. She, gosh, it seems such a lifetime ago, but we were in the same residency program for about a year.
So Marcia was your student, and she always points out to me how kind you were. You were so kind to her, and thank you, Eric.
I appreciate that. Thank you very much. I've gotten in touch again with having students, and we have New Vance has a residency program out of Northern Dutchess now, and it's really the value of it to me is becoming more and more important. I look for, so that's nice to do. And by the way, do you ever, that might be something, you might want to consider having a student in your office for a couple of weeks, or, because the neck and back problems are so ubiquitous, to have, and, just to bestow some of your knowledge upon them.
Yeah, we have students time to time, but if they want to start to send students routinely, I'd be happy to take them.
Yeah. All right.
If a patient wanted to see you, Dr. Hansraj, how could they reach out to you?
So our number is 845-471-9200.
And, I don't want to get the details, but you accept a various amount of insurance plans, right? I guess, being part of New Advance, you probably accept the same plans I accept.
Exactly, yeah, we're in all the plans.
Yeah, I always tell patients.
I don't know anyone we're not in.
I always tell patients we accept many plans. Our standards are very low. There was a time when I was in private practice where a patient came in and said, "You're the only guy within 100 miles on my plan. You must really stink."
That's not true.
So it could backfire. But all right, Ken. Well, thanks for calling in, and thanks for the work you do. And I think that's the beginning, I worked part time for Dr. Hansraj about 15 years ago. So he and I have a little bit of a history here. So I'll say this is the resuming of a beautiful friendship. Is it a relationship? What's the famous line?
I can see that. I can see that between the two of you.
Eric and Rob, and it was really nice to be with you two. Have a great day.
All right, thanks for the work you do.
Okay, bye, guys.
All right, bye-bye. What is the famous line from Casablanca? Ken, do you know? Not Ken. Dan, do you know? The ending of Casablanca, the famous line is, I have a feeling this is the beginning of a beautiful...
Friendship.
Friendship or relationship?
Friendship.
It must be friendship.
Yeah.
All right. Well, again...
Call in with a correction, audience.
What great work he does, and really, it's not about having surgery. It's about what's, taking care of your neck and your back and what treatment is right for you. It might be surgery, but, he's a back doc. I guess I kept referring to him as a spine surgeon, but, that kind of implies that he operates, but he does a lot more than that.
So he's a spinal specialist.
Spinal specialist.
So anyone who's suffering with, if you're out there and having some back problems, it might be wise to reach out to Amazon for one of these books. I mean, it seems like there's a lot to know. And I find it very interesting that, he's saying you can preclude your back problem injuries by staying active and, just moving. I mean, he was very clear about that. He was like, do the dishes, do your laundry, walk some steps, just keep moving, keep going.
I had a friend who used to refer to all her housework, and it depends on how you approach your housework too, how much you exercise with it, how you shovel snow, how you pick up things, and what muscles you're using. If you're conscious of it, it's almost a yoga, and that's what she used to call it. She called her housework yoga.
Well, house yoga.
Her yoga, yes, house yoga. And I was impressed with how often he was referring to 6,000-year-old body technology, which is yoga.
Yeah, right. The breathing has a lot to do with that.
Planking, all of these things. The pigeon is a yoga position. And
I'm trying. Yeah. I'm trying not to slouch so much.
Right.
Yeah, I became so conscious of my back and my standing and everything while we were talking.
I saw you practicing the pigeon.
Yeah. Well, you can't until you're on the floor, really, from what I can see.
Yeah, the pigeon looks like a stretch that you'd have to work toward if you haven't stretched.
Okay.
So.
Yeah, and there are grades. I was watching a YouTube video on a pretty good one. On how to do it in stages,
right?
Until you get to the position that fits you.
It would be important, right, just to not. Yeah. You don't want to do too much too soon.
Oh, absolutely. Well, the whole premise behind yoga is to go to that point of stretch, no matter where it is for you, whether it's only 10 degrees rather than 90 degrees. It's that point of stretch that you find is beneficial.
I've had patients injure themselves with yoga,
and that would be too bad. That's really a bad teacher.
Well,
somewhere
I think
along
maybe
the
they
line,
were being, I don't want to blame
or overzealous.
Hypervigilant.
Yeah.
Yeah.
There is no try, only do.
Yeah.
How's the yoga teacher talk?
No, the yoga teacher doesn't say there is no try, only do. That's Yoda.
Oh.
Not yoga, yota.
Oh.
That's very funny.
What about yoga when you do it out in the snow?
Oh, here it comes. Go ahead.
You say it'll be funnier.
That's frozen yoga.
Okay, very good. All right.
Sam liked that joke.
All right.
So that was really informative. So nice to hear from Dr. Hansraj. And he's taking very good care of you, and he's taking very good care of Sam.
Yes,
and
yes.
so...
And I encourage people who have chronic neck and back problems to consider seeing him. And even if you already, the whole idea of a second opinion, I mean, it's okay. A fresh set of eyes is it's not necessarily a challenging or an undermining of who's providing your care. It's kind of augmenting. Sometimes it's okay to take a step back and have some kind of just look at your problem from a new perspective.
Right, and you often say that you'll send someone for a second opinion because you want the doctor to either agree with you or disagree with you.
Well, it's common for patients to say, and we don't like this, by the way. What's he going to do for me? We don't like that. I think you need to see Dr. So-and-so. What's he going to do for me? And I'll say, well, he's either going to agree with me, which will be good, or he's going to disagree with me, which will be good. Either way, I want you to go because I need his input or her input.
Right.
So, yes, the whole idea of a second opinion is, and look, some people have serious diagnoses, cancer, for example. It's standard to get a second opinion. But even things like, consideration for neck or back surgery, I think it's okay to get a different perspective.
I think the takeaway is really to keep moving and even just taking that 1 point, Dr. Hansraj, if you did a 1 minute plank every single day for a year, how your health would improve. I think you can give yourself a minute.
I walk the plank every day.
So I got a message on Facebook.
Okay, go ahead.
And it was from Dr. Mark Tack, infectious disease specialist. And it says that he woke up to 5 new COVID-19 consults in the hospital this morning. 3 of them are under the age of 60. And then he stated that the vaccine cannot come soon enough. I just wanted to share this with the audience because I just think that it's important that the most highly revered infectious disease specialists are saying that.
And by the way, I'll say the name because these are public figures. Should we wrap it up or?
No, we have a couple minutes. Yeah.
I mean,
please, 2 minutes.
Senator Rand Paul is actually a physician. He's trained as an ophthalmologist, and I'm sure he's an excellent ophthalmologist. But he was also saying stuff challenging basically the opinions of the infectious disease experts over the weekend in an interview. And I would, I'm a family practitioner. I would never tell him how to operate on eyes. I would never assume that I know more about the eyes than the ophthalmologist does. The realm of hubris, where this comes from is so tremendous that he knows better than infectious disease specialists like Dr. Tack or the famous Dr. Fauci and Dr. Birx. So people, please be judicious and scrutinize, where your information is coming from. All right, I would not trust the opinion of a doctor who is not a specialist in infectious disease or immunology over a doctor who is, and keep that in mind, okay? Because Dr. Atlas was another guy who's a neuroradiologist who also had an opinion, and they're wrong, and history will show them to be wrong. All right. Anyway, there's a little editorial there.
I think it's important to say it.
Senator Rand Paul, I'll give you my cell phone number if you'd like to call me. I'm sure you're listening. Anyway, I think next week is our last show of the year.
How did that happen?
I don't know.
New year.
I do want to wish everyone a happy Hanukkah.
Yes, it's the 5th day of Hanukkah today.
Right, and we'll try to wrap up this interesting, amazing, and honestly in a good way year of 2020.
Hope for all good things going forward to 2021.
Right. Anyway, we'll be more sentimental next week. We'd like to thank you for listening. We'd like to thank Dan and Lawrence Maxwell and his mother as well for allowing us to do this. Thank you very much to Dr. Ken Hansraj for being an excellent guest. And we'll see you next week. I am trying to line up a guest, Dr. Rand Paul.
He's coming?
Yeah.
All right.
No, I doubt it. All right. That would be great, by the way.
Sure, we'll go with that, boy.
Have a wonderful day.
All right. Take care.
Thank you, Dr. Eric Stanberg, Robin Baker, and a very, very special thanks to Dr. Ken Hansraj, spine specialist and surgeon, for all of his insight on spinal health and therapies. And we thank you for sharing the morning with us and participating in Kingston Community Radio, KCR, AM 920 and 92.5 FM, WGHQ. Enjoy the first snow. It's an 85% chance of snow this morning, and it is still snowing here in uptown Kingston with a high of 36 today. And don't forget, by Wednesday night, Tuesday we'll have sunshine, but Wednesday night we're going to definitely have a possibility of a snowstorm, 8 to 12 inches possible. And thank you for being with us, and until tomorrow morning at 7 a.m., we wish you every success in growing and developing Kingston and all our neighboring communities. We now return you to Real Country Radio.
This is Real